Bismillahir Rahmanir Rahim. My name is Dr. Tawakar. I am ophthalmology resident. I want to see a change in ophthalmic practice by the year 2030. So if we focus on one thing, we can achieve that goal, which is change in ophthalmic practice by the year 2030. What will be that one thing? If you focus on that, we will achieve that. The one thing that is education. If we focus on education, we can achieve that goal. Then question arise, educating what and educating who? Educating 5 P's. That is the PGRs, postgraduate resident, peers, public, patients, and the people who are making the policy and the policymakers. What do you think? There are inequality between these 5 categories? Yes, there are a lot of inequality between the training of the PGRs and between the public awareness of the public and patients. There are a lot of myths regarding ophthalmic practice nowadays. Do you believe in that? Yes. There's a lot of myths. Until now, people, they are thinking that the squint or strabismus, it is a sign of luck. And they are removing the foreign body with their tongue. And also, they are suspending a needle for the multiple problem of upper eyelid, like herdurum. And I have seen myself this scenario during my childhood. And also I have seen currently in this years in our OPD patient present, and they have removed the foreign body with their tongue, and after that there was she had a keratitis. So for these reasons, we will take an oath, which is called a teacher oath, to achieve that aim or goal, which is the education. We had one oath during our MBBS. That was Hippocrates oath. This is the teacher oath. So I am calling teacher oath. What it said? It said that it is saying that I will spend those extra few minutes in health education of my patient, whatever. So I will educate my patient. I will train my residents and ophthalmic assistant so that they become competent eye care providers and they fall in love in this wonderful field of ophthalmology. So these are 3 categories. Number 1 was patients and public. Number 2 is resident and ophthalmic assistant, which is the PGR, and also our peers. And I will strive to teach every single day so that I can transform this world in a better place to live. So if we repeat these words with ourselves every day, so inshallah there will be an effect on us and we will transform this world into a better place to live. Because teaching is learning. If you teach someone, you are learning by yourself also. This is a Bloom pyramid. The experiment showed that if you are taking a lecture from another person, which is the passive learning, you are just taking 5% of information. If you are reading by yourself, 10%. On audiovisual, 20%. On demonstration, 30%. If you are discussing with a group, you are learning now actively. You are working yourself, so you are absorbing information 50%. If you are practice by doing, that is 75%. If you are teaching to others, you are actually educating yourself, you are learning 90%. So you know that we have two eyes, two ears, two hands, two hemispheres. So every these areas have a different central area in our brain. If we use all these brain areas, so we are learning by that very well, actively. So this is the same pyramid which showing that lecture, reading, audiovisual, demonstration, discussion, practice by doing, in teacher, teach to others. You can learn more. One is passively learning, another is actively learning. Auditory learning and visual learning. These are different parameters. Because we want an excellence in eye care, we have to teach to reach, and we have to struggle for that to bring the change in ophthalmic care. During my 4-year residency, we had multiple activities in our department, and that was very wonderful activities, and experiment showed that was very successful. So I am sharing that, and these all are practical steps. Everyone can apply that, and these are academic activity. This is a tradition in our department that all our team, we are welcoming to our new residents by flowers. This is our resident. We have in our ophthalmology department 3 program. Number 1, FCPS, which is controlled by CPSP, College of Physician and Surgeon, Pakistan, and another is MS, which is Master in Surgery, which is under the University of Health Sciences, Lahore, and another is Diploma in Ophthalmic Medicine and Surgery, which is under the National Medical University. And we are welcoming all of them. And also this is a new resident of FCPS. On the next morning, when he has joined, that resident, if he has a duty in his OPD, he have to be present in OPD room. If he has his duty in the operating room, he have to be present there, because he want to change. If you want to change, first you have to change yourself. This is also the operating rooms. At 8 o'clock you have to be present, and also this is the morning meeting 8 o'clock in the ward. Because you know, nowadays the measure of intelligence is the ability to change. It is the saying an Albert Einstein, if you have a choice between talent and hard work, which one you will choose? Let me ask in another way. On which one you have control? We don't have control on talent, but we have control on hard work, and I have to choose the hard work. And the experiment showed that a person who is working hard but less talent, he is more successful than a person who is talented but not working hard. So the first thing in training, that you should have the ability to change, and you have to be more flexible during your residency. And this is the Monday and Friday mandatory presentation on predetermined topic by the residents, and we are selecting a topic, for example glaucoma, and there are multiple topics that is assigned to every resident, and they have to make the presentation and they have to study about that. and they have to make a scenario, and this is full interactive session, and that is from to every PGR, not a particular PGR. Every PGR should participate, and they can learn everything, how to present and how to make slides. And also at the end of that presentation, there is a feedback from the seniors, and if there is deficiency, and how to improve that. And also we have long case presentation by the residents 4 days in a week, and we are discussing, we are debating about disease which which has presented in our department, and just we are making a scenario of that actual patient, and we are about the sign, symptoms, clinical feature, investigation, and management. This is also a long case presentation. And also in the diploma in ophthalmic medicine, we have a basic science course every morning until their 1 years. They are studying anatomy of the eye, physiology, pharmacology, and then pathology. And when they have achieved that level, then they joining our clinical sessions. When there is multiple lectures, after taking attending multiple lectures, we have every 3-month assessment of the resident, because this is the policy of our supervisor. He is saying we teach, we assess. This is also a 3-month assessment of the PGR on different whole chapters. And also there's an opportunity also available for house officer, which have a 3-month rotation in our department, and they have a chance on the first month and also at the end of the rotation, and they are also learning how to present the patient and how to present the presentation, and these are learning from them, and they are also qualifying from this presentation to the best house officer award, which we have every 3 months. And this is one of our best PGR award, which is presented by our respected HOD. And also this is a best house officer award, which we have every 3 months, which have a specific criteria. And also our department PGRs and our seniors, we are collectively attending multiple national conferences, and this is one of the Khaybar Icon Conference Peshawar, and this is Lahore Ophthalmo Conference in Lahore, and a whole of our department that is present there, from the senior to junior. And also we have also a pre-symposium workshop in Nishtar Medical University. This is we have a symposium, and this is pre-symposium workshop, and we are asking PGRs and also all people who are around this area. And this is annual symposium in Nishtar Medical University. These are our department group photo, which our seniors and our resident are in the at the end of the symposium. When a PGR or postgraduate resident, he is completing his 2 year in our department, to increase his chance in exam, to increase his passing chance in exam, our department, they are in this when we have completing our 2 years, we have a chance to appear in intermediate module exam. So before appearing in actual exam, our department, they are organizing a mock exam to increase our chance in that. This is one of the IMM mock exam before actual exam. And after the passing of exam, our respected HOD, he is motivating and appreciating that PGRs, which in this picture we can see our 3 residents, 2 from MS and 1 from FCPS. They have passed their intermediate module exam, and we have organized a ceremony for them in a hotel, and we have motivated them, and this is a very good tradition in our department. I like this. And this was a very proud day for me when I have passed my intermediate module exam, and my professor Rashid Kumar Rao Sahab, he has asked whole the department, they came in the early morning, and we have celebrated that day, and he has given me a special gift, and I'm very thankful from him. And we have also a continuous medical education session in our department by our seniors, and we are targeting one topic like glaucoma. We are completing, and our senior, they are sharing their experiences with ourselves. Then strabismus, then nowadays we have surgical retina. This is a continuous medical education. And also now when there is an end of our residency, our department, they are organizing for their PGR, and also for PGRs around the Pakistan, and they are asking to appear in exam which is called part 2 exam. To increase the chance in the actual exam, we are appearing in mock exam, mock part 2 exam. And this is an image of that mock exam. In all our the PGRs all over from Pakistan, from Islamabad, Lahore, Karachi, Peshawar, they have attended this session in our department, and we have also participated. This is also our PGR from our department, and this is a group photo which I was also the only participant. I was also the participant of this mock exam, part 2 exam. Alhamdulillah, it was a great experience for us. It was a great experience for us. And also at the end of mock exam, there is an appraisal at the end of mock exam and recommendation by the examiner to the resident, and in which area they have done a mistake and how they can improve that, and they will increase their chance in the actual exam. At the end of this journey which we have started 4 years, now it is a time for the result. We are not responsible. We are responsible for our actions, not for the consequences, because the consequences will follow the natural law. If you have done best in your 4 years, inshallah your result will be wonderful. So after attending multiple national conferences, attending multiple lectures, taking the lectures, giving the lectures, now it's the time for the result. And one of the good tradition that we have in our department, our department postgraduate resident, they are passing their exam in first attempt, and this is one of the resident who has passed his FCPS ophthalmology exam on first attempt, and our respected seniors, they have given the gold medal to him, and this is the gold medal to an MS ophthalmology part 2 exam in which she has passed on first attempt. And this is also Dr. Farooq, which he has passed on first attempt his MS ophthalmology exam recently. And we are appreciating a new consultant who has passed their ophthalmology exam. And also I love this tradition in our department, in which we are arranging a party, a farewell party for the resident who has completed their residency in our department. And these are the images from that, and a gift which is presented by our respected professors. At the end, there is one share from Allama Iqbal Lahori. He is saying that this is actually the share of Persian or Farsi. He is saying, Agar yak qatrahi khoon dari, agar musht pare dari, biya man ba tu amuzam tariq shahbazira. The meaning of this is that if you have a drop of blood, he is saying to a youth, if you have a drop of blood, if you have a small part of your wing, be a man. He is saying, come to me, I will learn to you how to fly. So Alhamdulillah, our resident, they have a 5 liter blood, and they have a complete wing. So if anyone, they want to be a consultant in ophthalmology, come to ophthalmology department, National Medical University, so you will become a consultant, and through this multiple academic activities. So at the in a conclusion, I will say that what I have said and what I have explained, these were just so what I'm saying that this, what I have shared with you, this was just as an iceberg, and this was a peak of the iceberg. Because of I cannot share the all activities that we have done, but this was the most activities we have done, and these are all practical steps, and everyone can apply in their department to train their PGRs. And one thing that is the core values of our department also, that is punctuality or discipline, and you have to be punctual. And also the second one is be respectful. If you are respectful, if you are punctual or be disciplined, you can gain the knowledge. So I'm very thankful, especially our respected Sir Rashid Kamal Rao Sahab. When I have joined this department, so at that time there was no one known to me in this National Medical University. So he asked me, do you know anyone? I said no. He said, no problem, I'm everything for you. So he has given us in this 4 year very good support. I'm very thankful from him and from whole department. At the end, I will say the reference of this picture was from our Facebook page of ophthalmology department Facebook page, and I'm thankful from Dr. Asfand and Dr. Asfandyar, which is our colleague. He has also completed his residency here, and also Dr. Ahmad Masood, and we have a rich source of these pictures. And also one thing that we have experiencing during our residency, that is also we are teaching to house officers, the resident, postgraduate resident, which is a wonderful experience for us. And also we are teaching evening classes to our 4th year MBBS, and they are coming in a different groups in different days. And also we have optometry in our department, 4-year optometry program, and our PGR, and they are participating in training of them and giving a lecture to them. So this is also a wonderful experience for us. And also we are participating actively, our PGRs, how to take the exam of 4th year and optometry. So these all are part of our practice, and these people who are participating in this, they are the future leaders. At the end, I will have one share of Allama Iqbal, that is in Urdu. He is saying, nahi hai tera nashiman gunbad sultani par, तू शाही है बसीरा कर पहाड़ों की चट्टानों में. The meaning of this is in English that I will say that your place is not the palace of a king. Tu shahi hai, you are an eagle. You have to go to the peak of the mountains, and you have to do everything by yourselves. The meaning of this in a simple word is that leave your comfort zone. I am so thankful from all of staff of ophthalmology department, and I had a very wonderful time with them. Thank you. Assalamu alaikum wa rahmatullah.